Hi everyone, Huma here. I'm really sorry I couldn't be at this meeting in person, but I wanted to take the opportunity to talk about the recent International Labour Conference that happened here in Geneva. As you know, we were participating in the general discussion on decent work and the care economy, the outcomes of which will set the future direction of travel for the ILO and its work on care. So it was hugely important for us to have a delegation of PSI affiliates participate in this general discussion because PSI is one of the largest representative bodies of care workers. As you know, we are advocating for a radical new approach to care that not only values and supports its workforce, but also delivers better quality care for all. The level of care that people need is growing globally, and our ambition was to make sure that we secure references to quality publicly provided care services where workers are paid properly and treated with respect. So for 2 whole weeks in Geneva, our members negotiated to influence the outcomes of the general discussion, trying to secure these commitments, trying to secure references to decent work for all care workers. And honestly, it was a mixed picture. There were some good bits. There were some bits that maybe we would have liked to have been stronger. But I think the big overarching success for us was that the outcome document recognises the state's primary responsibility to deliver care services and acknowledges that care work is not a commodity. This is a significant win for PSI. And it's also a significant win for the wider global labour movement, which were united around these demands. However, unfortunately, the outcome document also promotes the use of public-private partnerships. And as all of you know, and what PSI has been advocating for a number of years now, is that public-private partnerships consistently undermine the delivery of quality public services. And PSI, in these general discussions, we submitted lots of examples and lots of case studies of where public-private partnerships go wrong. They don't necessarily lead to better outcomes. We have numerous cases of where workers are mistreated within public-private partnerships, where service users aren't receiving quality services. And we're really adamant that public-private partnerships have no space within the care sector. And it was really reassuring for us to see that the global labour movement was united behind PSI's call against PPPs, against public-private partnerships. But unfortunately, the employers and the governments within these negotiations didn't agree with us. They thought that there should be references to public-private partnerships within the document, within the outcomes. So unfortunately, the outcome document does reference the provision of public-private partnerships. So I think that is a huge lesson for us, I think, and shows that where we need to kind of become stronger at. And we will be working together with our affiliates to, maybe develop some more research, to write up some more case studies, to do some more kind of training sessions about how we as the global labour movement, we as PSI can really push back against public-private partnerships, because the evidence is all there and the evidence is clear, is that these instruments don't necessarily lead to better quality services. They also have a huge impact on governments. They're not necessarily better value for money. Workers aren't being treated better. And it's just an agent for further privatization of public services. And it kind of goes against what we believe here at PSI and what our affiliates are pushing for. But as I mentioned, the workers group were very united around, pushing back against public-private partnerships. They were also united around the key principle of care as a human right and also care as a public good. There was lots of examples where the workers were saying that we can't have further commodification and privatization of care because we know, profit is being placed ahead of workers and it's being placed ahead of service users and wider society. We were pushing quite strong, united with the workers group, on kind of better protections and recognition of migrant and informal care workers, such as community health workers and domestic workers. There were some references in the document to these groups of workers, but unfortunately it didn't go as far enough as we would have liked to have seen. negotiations got quite tense, I think, towards the end. And as you know, the employers were incredibly strong, and the governments didn't come out and support our position as strong as we would have liked them to. So I think that's a big learning for us. Something we want to do at a global level is to really build those relationships with government, with PSI, regional and sub-regional offices. I know in some regions, particularly Latin America and the Caribbean, you guys have really good relationships with your governments and really advocate for PSI and your members with your governments, but we really need to see how we can do that in other parts of the world to make sure that when we go to these negotiations, we have the backing of lots of different people. And there were some good references to kind of ensuring decent work for care workers. There are references within the document on collective bargaining, freedom of association, the elimination of discrimination, and occupational health and safety. We also secured the inclusion of the state being the primary provider of care services and the need for a robust policy and regulation framework. I think that's hugely important for us because you can't have services where the state is not involved. We need states to take a more active role in the delivery of care services and really regulate how these services are being managed, how they're being delivered, how they're being procured within their countries. But I think one thing that's clear for us is that, workers and unions globally, we need to remain strong and united to push back against the idea of public-private partnerships within care. We need to reclaim the public nature of care services and really make sure that we're pushing for states to have the primary responsibility of providing care services. And where does that kind of leave us now? Where do we go next at PSI? I think we're going to be reflecting internally. I hope at this meeting you guys will be reflecting and understanding what is important for you guys within the region, where you think within the region, which parts of the outcome documents are most relevant for you, what relationships you can have with your governments to really push back against certain things within the outcome document. But at a global level, we will be having a meeting for all our affiliates within care on the 1st of July to have a discussion about what we do next, like which specific actions we can take. I think we as staff have an idea, but I think we really need to engage with our affiliates. Those are the ones who were there at the general discussion, but also the ones who weren't able to join. Have that discussion with our affiliates to decide our, concrete actions that we need to take to really, build this momentum to push back against public-private partnerships, but also to continue the fight for decent work for all care workers. I really hope to see all of you there. We've circulated the save the date with the registration link. We'll be circulating an agenda very soon. But as I mentioned, it would be really useful to see many of you there, to see what you've discussed today, to understand which parts of the outcome document are most relevant for your region, how you think we can best unite with our allies to fight back against the privatization and for decent work for all care workers. So that's a very quick rundown of the outcomes document and where PSI stands. But I hope to see lots of you at the global meeting, and I'm sure you'll have more in-depth discussions about the general discussion today, particularly with Veronica, who was there in person with me. So thank you so much, and I shall see you then. Thanks, guys. Bye.